Welcome to the deep dive. Today, we're jumping right in, straight to the information you need on a really crucial topic for well-being.
Heart health.
Exactly, heart health. We're doing a quick deep dive on cholesterol testing.
And we're using a fantastic guide as our source.
Yeah, from the experts at Blood Test UK. Our whole mission here is just to pull out the most actionable knowledge for you.
And what's so great about this one is the local focus. I mean, this guide is specifically for people in, like, Bath and Somerset.
Which makes it so much more practical.
It does.
Okay, so let's unpack this with, simple language. What exactly is a cholesterol test?
Well, it's a test that measures the fats in your blood. You've probably heard people talk about good fats and bad fats.
And HDL and LDL.
HDL is the good one. You can think of it as the cleanup crew. It helps get rid of the extra fat.
And LDL is the bad one because
too much of it can build up. It can cause these blockages, this plaque inside your arteries.
And that's what leads to the serious risks, like a heart attack or a stroke.
Precisely. Now, there is a really important detail about preparing for the test.
Ah, right, the fasting.
Yes. For the most accurate results, you usually need to fast. So, no food or drink, except for water, for about 9 to 12 hours before the test.
Why is that so essential?
It's mainly to get an accurate reading of your triglycerides. If you eat right before, those levels can spike and, skew the picture.
I see. So the big benefit here, as Blood Test UK points out, is that regular testing lets you catch problems early.
That's it. It's all about early intervention.
And here's where it gets really interesting, especially with that local knowledge. If you actually live in Bath, this guide tells you exactly where you can go. Places like the Bath Medical Group, RUH Bath.
Even some Boots Pharmacy locations are mentioned. It just removes all the guesswork.
What about the cost? I know that's a big question for a lot of people.
Well, testing is free on the NHS for patients who are eligible. But if you're looking at private tests, which Blood Test UK gives insight on, they usually cost somewhere between, say, £20 to £100.
Depends on what you're getting tested, I imagine.
It does. And when you get those results, what should you look for?
The big one is LDL, right? The bad one.
That's the one. Experts want to see that number ideally below 3.0 millimole. If it starts getting up above 4.0, that's a clear signal.
A signal that you need to pay attention.
Definitely. A signal to take some action.
So what does that mean for daily life? If your results come back high, what changes can you actually make?
The results basically give you a blueprint for action. So first up is food. Focus on heart-healthy foods.
You mean like fruits and veggies, whole grains?
Yes, and especially things with lots of soluble fiber. Think oats, beans, apples. They physically help remove cholesterol from your body.
And what about exercise?
The goal should be at least 150 minutes of moderate exercise every week.
So even just a brisk walk counts towards that.
Absolutely. And, it goes without saying, but if you smoke, quitting is the single best thing you can do for your heart.
So the big takeaway here is that ongoing monitoring with clear advice, like the kind from Blood Test UK, helps reduce your risk of serious problems.
It does. And it can even reduce the need for medication over time, which improves your quality of life.
A pretty clear summary then. Know your numbers.
Exactly. Okay, so here's a final thought for you to consider. Healthy adults are generally told to get tested every 4 to 6 years.
Right.
But how should someone with a family history of heart disease, or maybe obesity or diabetes, adjust that schedule?
They'd need to be more proactive, I'm guessing.
Much more. The guidance suggests they may need testing every single year or maybe every 2 years just to stay ahead of any issues.